This is a post-DALK patient with a very high astigmatism of more than 23 diopters. The visual acuity was 2/60, not improving with glasses. This is the Intraoperative Keratoscope mount, which is fixed onto the Leica microscope. This is the Intraoperative Keratoscope. It is fixed onto the mount. You can see a green mark which is aligned to the center of the mount, and then it is rotated anti-clockwise until you hear a click. The adapter is connected to power, and you can see the intraop rings glow up. The intraop ring is now aligned onto the patient, and you can see that I am using a guarded knife to open up the old DALK section. You can see that I have now opened up at 12 o'clock and I am slowly gone to 3 o'clock and to the 6 o'clock position. And you can also see that I am trying to open up the 7 to 8:30 position also. Once I have opened up and loosened the edges, I will be using multiple sutures to flatten and tighten the areas. You can see here that I have put one suture at 3 o'clock and I am proceeding to put a suture at 9 o'clock. So you can see me during this procedure that multiple sutures are used so that to achieve a perfect ring. You can see that there is still an oval mark around 11 to 10 o'clock position. So I am again using a Sinski to open up the wound so that I can adjust with sutures. While suturing, care is taken that the decimus is not perforated at any time. It should be partial thickness only and should not go full thickness. When suturing, always have an eye over the two rings. When the two rings are much closer, it means that area is very flat and you need to open up the wound to make it sized regularly. Once the wound is opened up, a suture is used to exactly align that area so that the two rings are equally spaced. Additional sutures are also placed as for counter traction and also to make the myias regular and the spacing even. So you can see here that almost a very circular ring is achieved and a BCL is applied. This is post 1 week. You can see that how well the cornea has flattened. From minus 23 diopters of astigmatism, it has come to around 7 diopters. The point to note here, you can see that how uniform the cornea is. You can see that the visual acuity from 2/60 has improved to 636 with a correction to 6:9. Thanks to the Intraoperative Keratoscope, without which such results are impossible.